Our breathing can be influenced in a variety of ways, but to understand how we can consciously influence our breathing, let's first break down the components of the breathing cycle. So first of all, let's think about the breath in terms of rate and depth, two really simple components. Firstly, the rate. So the normal adult breathing rate is calculated at the number of breaths per minute. And in an adult at rest, this can be anywhere between 12 and 15 breaths per minute. Research has shown that simply bringing attention to the breath, maybe even closing the eyes, you actively slow down the rate of breathing, and this can influence the nervous system and the way we perceive whether we're in a stressful situation or not. So slowing down the rate is point number one. Then we move on to the depth of breathing. Now, to understand the depth, we need to do a deep dive into the muscles surrounding the rib cage and all the way up into the neck and the back. So the muscles of respiration involve these tiny muscles in between the ribs called the intercostal muscles, and then up into the neck, these rope-like muscles called the sternocleidomastoid and the trapezius and the scalenes going all the way around to the back. Now, these complicated names are essentially all bundled together in a term called the accessory muscles of respiration. And I like to think of it like accessories on a night out. So when I'm getting ready to go on a night out, I might grab an extra accessory like some jewelry or a handbag or a nice tie. And when you grab those accessories, you're really adding them to your repertoire for the get up and go of your night out. And it's really similar with the breath. The accessory muscles are recruited only when we need that get up and go, that fight-flight situation. And therefore, we really don't want to be breathing up into the neck and the chest. What we want to do is recruit the major muscle of breathing, the so-called breathing diaphragm. So to illustrate this, I'd like you to take your hand and place it at the lower border of your ribs. The breathing diaphragm is a parachute-like muscle that marks the periphery of the lower border of the ribs, and it moves like a jellyfish, up and down. And there's another muscle I'd like to introduce. Take your other hand and place it underneath in a cup-like motion, and that is your pelvic diaphragm. Your pelvic diaphragm or your pelvic floor is another sling-like muscle that exists at the lower border of the abdomen. It attaches from the front bone, the pubic symphysis, round to the edges of the pelvis and back to the sacrum, your tailbone. So if we hold our hands like this, we can imagine how these muscles move. First, the top hand. As we take a deep inhale, this muscle moves down, so the hand flattens and the belly pops out. Inhale, the muscle moves down, and as we exhale, it bounces back up. So inhale down, exhale back up. And interestingly, the pelvic diaphragm moves in the same way. So as we inhale, both hands move together. As we exhale, both hands move apart. This contraction and this elongation provides a rhythm to the muscles of the abdominal wall. And this is really the muscle that we want to recruit, the breathing diaphragm, in breathing deeply. So if we take this ball for an example, if we place the top hand, and that's the breathing diaphragm on the top and the pelvic diaphragm at the bottom, look what happens if this represents our gut. If we breathe in, both hands move together, condensing, and as we exhale, both hands move apart. So there's this condensing and this elongation of the muscles that provide this movement to the gut and also to the muscles of the abdominal wall. And then we think about what were to happen if we do that classical instruction of tighten the belly, tighten your core. If we tighten the core and we hold our breath, we can sometimes contract the diaphragm. And then there's this lack of buoyancy, this lack of fluidity, and the bounce back that can come from the pelvic floor. Similarly, if we switch on the pelvic floor and we start to contract the pelvic floor, there's a lack of buoyancy at the top and a lack of feedback. So what we want is for both of these muscles to be moving in a way that's fluid and natural. And we do that by allowing lack of tension in the whole of the muscles surrounding the abdominal wall to enable fluid motion to be communicated to the gut as well.